Hello everyone, my name is Melanie Pescud and I would like to acknowledge the Whadjuk Noongar people upon whose lands I'm recording this presentation from today. I extend my gratitude and respect to all elders past, present and emerging. And on behalf of my colleague, Professor Lucy Wright-Chetnick, I'm proud to present our Prevention Systems Change Framework. An important requisite for addressing complexity within a system is practicing systems thinking. And while there are many definitions and disciplinary traditions, one way we like to define systems thinking is about taking a vantage point from where you can see the whole, a web of relationships, rather than focusing on the detail of any one particular piece of the whole. And this means that events are understood in the larger context of a pattern that's unfolding over time. Systems thinking means considering all the interconnected and interdependent parts of the system as a dynamic whole. And systems thinking helps us to better understand the complex drivers of chronic disease and where we can nudge the system to achieve possible solutions. Still, many of us researchers get stuck at the point of describing systems rather than articulating how to create change within them. And even when the evidence tells us what is needed, we sometimes feel hamstrung to act or are not sure about our role or responsibility in creating systems change. Therefore, the Prevention Systems Change framework we developed is underpinned by systems thinking with an explicit focus on change making. The Prevention Systems Change framework illustrates how to work to create systems change through 4 iterative steps. 1, applying a systemic lens to the prevention problem being studied. 2, holding an implementation focus. 3, integrating the systems lens and the implementation focus together. And then 4, developing a theory of systems change. So the 4 core steps. When it comes to applying a systemic lens, users are guided to think through a series of questions relating to policies within the system of interest, important connections between stakeholders and organisations, to think through who has power and influence, the types of regulations in place with the system, the attitudes and values held by key players, and the key leverage points for creating change. And the questions are designed as a guide. We really encourage users to modify them as required to meet their contextual needs. When it comes to taking an implementation focus, there are 4 key areas to consider. These being the readiness of the system and its actors to create change, contingent capacities, and this refers to things like having a knowledge of the form and function of the system, understanding relationships between actors within the system, and having the skills to implement change. Diffusion is also an important part, which asks you to consider how to expand change-making efforts across the system. And finally, there's sustainability, which asks you to consider how new policies will be maintained, how to institutionalize new mindsets and practices, and how to support ongoing intersectoral collaborations. The next step is to integrate the systemic lens with the implementation focus, which relies on simple rules, such as engaging diverse perspectives and pursuing social justice. It also involves creating systemic action learning teams who are committed to ongoing reflection, learning, and change making, and creating small wins to maintain motivation and morale within teams. Finally, a theory of systems change is created, articulating the actions and reactions to creating systems change, including who will do what, who that will impact on, and what else will occur, and what is going to change with what outcomes. So in a nutshell, the framework will be useful for anyone planning a change within a complex system, from advocates, policymakers, and health promotion practitioners thinking about implementing a program, policy, or intervention, to those grappling with larger scale change that involves numerous interventions. We all need to be willing to reflect on our own roles within the systems we're studying and to look for our potential blind spots with openness and receptivity. And from our own experience, this is often confronting and uncomfortable, but such reflexivity can be supported by purposeful and sustained questioning and an ongoing process of reflection, action, and feedback from new and diverse perspectives. Arguably, if prevention research is to support improved health outcomes, it must be more explicitly linked to creating systems change. Incorporating systems thinking for systems change into our work is an important step in advancing the field of chronic disease prevention. The framework provides a tool to explore a complex system and articulate the types of actions needed to help us generate change. And it can be used to guide systems-based research planning, monitoring, study team reflective learning, and research evaluation processes. Thank you for listening, and bye for now.